Addiction in American Poverty Populations by Christian Alvarado and Carmen Despasquale. Poverty affects 37.9 million people in America, about 11% of the population. Most prevalent in southern and rural parts of the country, as shown in the graphic below. As of a 2023 U.S. Census report, the poverty line is around $15,000 for an individual income and around $35,000 for a family of four income. People who live in poverty have worse social determinants of health, which relate to risk factors that are associated with mental health disorders and addictions and other negative life outcomes. Social determinants of health associated with poverty include unemployment, areas of living that have high rates of drugs and crime, family and relationship stressors. These include domestic violence, sexual assault, and others include low levels of education and access to healthcare or quality resources such as food and recreational activities.
This slide breaks down demographic variables pertaining to individuals living in poverty in the United States. In America, based on age, 15.3% of individuals under the age of 18 are living below the poverty line. 10.5% of people ages 18 to 64, and 10.3% of individuals 64 years or older are living below the poverty line. Additionally, women are 35% more likely to be living in poverty compared to men. And then lastly, on this page, there's a graph demonstrating the rates of poverty among race, ethnicity. Leading that chart is American Indian and Alaska Natives at 25%, followed by African Americans at 17.1%, Hispanics at 16.9%, white or Caucasian at 8.6%, and Asian Americans at 8.6%, as well as the graph notes that 11.5% of all people in the United States live below the poverty line. Substance use disorder prevalence by employment status. For unemployed individuals, they've 27.9% have some experience with substance use disorder, compared to full-time employees having 20.1% and part-time employees having 20.5%.
So in this presentation, we will discuss specific populations that struggle with addiction, who are impoverished communities, such as the opioid crisis that is affecting rural America. Young Black people and Black communities are also affected by opioid overdoses. Native American populations are currently dealing with the ramifications of poverty that include substance abuse and substance addiction. Low-income communities are ultimately more vulnerable to addictions and overdoses because of their substance use and lack of mental health resources. Over the past 2 decades, rural Appalachia has stood out as having one of the highest rates of prescription drug abuse, specifically with opioids. According to a CDC report in 2015, 35.5 drug overdoses per 100,000 residents occurred in rural Appalachia, which is far more than the national average, 14.7 per 100,000 residents. Appalachia is one of the places that struggles with quality of education, a high rate of unemployment, and injuries that are related to the scarce remaining amount of jobs in the coal mining industry or labor-intensive industrial jobs due to the deindustrialization and the moving away from jobs that are related to the Rust Belt. The increase of medical staff prescribing patients opioids matched with little public knowledge around opioid abuse has resulted patients becoming addicted to the FDA-approved opioids, including Vicodin, OxyContin, and Percocets. The addiction stemming from these opioids can become injections of the drug, causing the user to be susceptible to hepatitis C and HIV. In terms of addiction treatment in rural America, rural areas like Appalachia struggle to obtain adequate health coverage because of insurance costs during down economic times. Residents who can afford them usually cut them, or loss of employee benefits. Lack of available healthcare professionals within the area is a big issue with rural Americans. Usually these places are have less population than urban areas, and therefore less of mental health practitioners. Treatment solutions may be ineffective, may be lacking a holistic approach to treating mental health conditions, which including CBT, cognitive behavioral talk therapy, or some alternative evidence-based intervention to go with treating addiction. And then ideologies that are oriented around modern healthcare or mental health treatment may prevent rural Americans from receiving treatment. And then lastly, like I said in the previous slide, education on substance use is lacking. Between 2013 and 2017, drug-related deaths were the highest amongst American Indians and Alaska Natives compared to any other racial population. Methamphetamine has been reported in higher amounts of use within the Native American population than any other drug, such as cocaine and marijuana. Native Americans can struggle to overcome the historical trauma from colonization of their homeland and structural inequities. Historical trauma is a risk factor that can lead to an addiction within Native American populations. Memories of colonization and abusive practices to forced boarding schools can lead to an addiction. Native American stressors also include acculturation pressure, so pressure that stems from conformity of the white majority is something that can lead to, is a risk factor as well. Employment discrimination and the declining employment rate, as spoken before, is also a risk factor. Alcohol is also relatively new to Native American populations, though it is not 100% clear whether coping with alcohol is the reason for the amount of alcoholism in these communities, or if they're genetically more susceptible to alcohol addictions because alcohol was not found in their communities before colonization. Mental health issues are also prevalent in Native American populations. Conditions found that 70% of American Indians and Alaska Natives men and 63% of American Indians and Alaska Natives females met the criteria for at least one mental health lifetime disorder as defined in the Diagnostic Statistical Manual 4. Protective factors for Native Americans include reconnecting Native Americans with their cultural heritage, spirituality practices, and discussing their personal struggles with someone who has gone through something similar.
Addiction and African Americans living in poverty. This slide looks at midlife alcohol use or heavy alcohol use amongst African Americans. And Mulia et al. 2022 found an association between low childhood socioeconomic status and a greater heavy drinking at midlife through a sequence of socioeconomic and school experiences that led to lower educational attainment. Pathways for midlife heavy drinking for women occurred through repeated unemployment and greater adult poverty duration. So this study kind of shows that in the United States, the treatment of African Americans in school are hindering their ability to elevate their socioeconomic status, which, as the study demonstrates, often leads to midlife heavy drinking. So the occurrence or prevalence of addiction, specifically in the African American population, is heavily influenced by how African American children are treated from a young age, starting from school and throughout their adult life. Addiction amongst adolescents in poverty. Lee and Clancy 2020 found that adolescents who have lived in poverty were more likely to use drugs. Adolescents from broken homes showed higher rates of substance use, and adolescents from single-parent households showed higher rates of problematic substance use. Some of this could be attributed to a lack of self-esteem that comes with coming from a broken home or a single-parent household, as having low self-esteem makes adolescent more susceptible to this behavior. Adolescents are less likely to engage in risky behaviors such as drug use when they have high self-esteem. Drug use among adolescents is more likely for males compared to females, and white adolescents have shown higher rates of substance use when compared to black adolescents. Additionally, when comparing substance use between white and Hispanic adolescents, use was found to be more prolonged for white adolescents. So the use being more prolonged typically means that for a white adolescent, their use is expected to or more likely to extend into their early 30s. Addiction amongst adults in poverty. Glass et al. 2020 found that adults who have experienced discrimination are more likely to suffer from alcohol use disorder. Individuals who are unemployed, have lower levels of education, and are living in poverty are much more likely to smoke cigarettes. Stinson et al. 2020 found that unemployed individuals who are seeking a job are more likely to prioritize cigarettes over job-seeking resources. A few examples of job-seeking resources would be a cell phone, transportation, grooming, and new clothing. And although not entirely responsible for their unemployment status, an individual's prioritization of buying cigarettes over job-seeking resources may hinder their ability to get a job and escape poverty and escape their addiction as well. Individuals with low socioeconomic status are more likely to receive coupons for tobacco products through the mail. So how society further incentivizes and enables people's use to keep them in the position that they're in. Addiction in Hispanics living in poverty. Bermia et al. 2020 notes that living in poverty causes the Hispanic youth to be more susceptible to exposure to gangs and violence. The study's findings supported the hypothesis that gang exposure is linked to substance use. But although the study may not be representative of the entire population of Hispanic people living in poverty, it does demonstrate a unique aspect of the circumstances many face. Addiction in immigrants. The process of immigration can be extremely stressful, and one would assume that the vast majority of immigrants are living below the poverty line for an extended period of time. Vasquez et al. 2023 found a significant association between post-immigration stress and alcohol use, specifically concerning Latinx immigrants. Vasquez et al. 2023 identified the fear of deportation and difficulty accessing healthcare as the primary source of stress in Latinx immigrants. And in addition to the stress that accompanies immigrating to the United States, immigrants are also likely to face the same challenges domestic racial minorities face that may increase the likelihood of experiencing some form of addiction. So basically, any African immigrants or Latinx immigrants or Hispanic immigrants, etc., may face the same challenges that other individuals of their race may face on top of the challenges they face as immigrants.